I'm here outside the King Edward Memorial Hospital where they're calling for volunteers in the Falkland Islands to join the blood donor panel. So in true FITV style, I've come to check out what it's all about and see if my blood's any good for use. Fingers crossed!
Caroline, start.
To test my eligibility for the panel, I needed to supply a small sample of blood for screening to ensure my blood is safe for transfusion. 5 tubes worth, totalling 26 millilitres, were collected using a vacuum system.
So you're going to feel a sharp scratch. You won't see any blood. Okay. Any point that you don't feel well, just let me know. What tends to be the most uncomfortable part of the procedure is the strap tends to sort of make a numbness in the arm, so you feel pins and needles.
Okay.
So that's more uncomfortable than possibly the needle going in.
The vacuum system takes out the exact amount of blood needed for the test to be administered, both in the hospital here in the Falkland Islands and in NHS blood and transplant labs in the UK. Locum biomedical scientist Neil Smith explained the next step of the process to me, which simply involved filling out a questionnaire, similar to the one completed by donors in the UK. Have I ever tested positive for HIV? So no. Hepatitis B or C? No. Have I ever been injected with illegal drugs? No. Have I ever been given... Okay, some of these I won't read out to the camera. The questionnaire is an initial step to ensure it is safe for a patient to receive my blood and for me to donate it. Once the medical team reviews the questionnaire and are happy with the answers given, they can sign me off to become a donor if my blood test comes back okay. FITV was given exclusive access to the pathology department, where Neil was able to begin screening my blood sample.
This test is what we call a full blood count. All we're going to do is to check your haemoglobin, which is to measure how many red cells you've got in the body, and your haemoglobin has to be a certain level for you to be able to donate blood. If your haemoglobin is too low, you won't be able to donate your unit of blood to a patient. So all this is a very quick test just to make sure your haemoglobin is at a correct level.
The full blood count is carried out here in the Falklands before the sample is screened in the UK for conditions such as HIV and hepatitis.
The result we're after there is HGB, which is haemoglobin. So anything above 11 is normal. 14.1, that's very normal. So that'd be perfect for you to donate blood. We can take a unit of blood off you and you wouldn't even notice it, and your body would recover within a day or so, and you wouldn't have normally you have no ill effects at all. But if that went below 11, we'll probably say you wouldn't be able to donate. So it's just a very quick test to see how healthy the patient is and the donor is before they actually donate.
The next stage was to test my ABO blood group, the most important category in human blood transfusion. There are in fact hundreds of different types of blood groups, but they are only important in rare occasions during blood transfusion.
What we're after in the emergency donor panel is the ABO blood group, because that is the critical one. That's the one that you have to get absolutely right. If you get it wrong, you give the patient the wrong ABO group, it can be fatal very, very quickly.
Any individual's ABO group will either be group A, B, AB or O. A further classification is the RHD group system, where the individual will either be RHD positive or RHD negative.
The RHD is not quite as important as the ABO group, but it's more important for if the patient was like a young female, childbearing age, the RHD group would be important as well.
In order to find out my ABO and RHD blood group, Neil spun my blood in the centrifuge to separate it into packed cells and liquid plasma. With the packed cells and plasma separated, Neil was able to mix my blood with various chemical agents representing different ABO and RHD groups in order to decipher which category I fell into. When the blood cells and plasma clumped together with the chemical agents, it indicated a positive result to that blood type, whereas no reaction reveals a negative result.
RHD, negative. That's less than 15%.
Really?
So that's quite new. So A neg is actually quite a rare group, because A pos would be A pos is far more common than A neg.
By mixing my plasma, which I now know is blood type A RHD negative, with blood cells from groups O, A and B, we can see what would happen if I were to receive a blood transfusion of the wrong type. Both A and O mixed well with my blood, but the cells from group B sample have clumped together with my group A blood, meaning that if this were to take place within my body, this could cause internal bleeding, shock and even death. Separating the blood is not only useful for testing the blood type. In fact, the blood is stored in its components, as some patients will only need packed cells, whereas others will just need plasma. As the plasma is frozen, it can keep for almost 2 years, but can defrost in just 20 minutes, ready for use in case of an emergency. Due to the shortage of blood here in the Falkland Islands, if you donate, it is guaranteed your blood will be used and will be available immediately. So that's it now, only a few more tests to be done and hopefully I'll be able to donate blood in November. A huge thank you to everyone here at the hospital that have shown us behind the scenes today. Hopefully this has given you a fantastic insight as to really what goes on, and fingers crossed this has inspired you to donate yourself, as it could save someone's life.